It's no secret the cost of living has gone up. Many pay rates and salaries aren't keeping up with those increases either. That includes professionals who work in mental health services. But as reporter Caitlin Keenahan explains, that could change soon.
It has been years since the state budget has been altered to raise wages for mental health service providers. Now, more than ever, their services are needed.
There's a workforce shortage across lots of industries. We're not immune to that, and we want to be able to retain really good quality staff.
Jerry Wagner, the CEO of the McNabb Center, knows the battle of a tight budget all too well.
If there are no increases, and we haven't had them in over a decade, it's like getting a 2% cut every year and still being required to deliver on your contracts.
He has seen wonderful workers walk out the door.
They're very qualified and they deserve to be paid at a reasonable wage in the market.
There's a pay discrepancy. Take a social worker, for example. They make 28% more in the private sector than they do working for a state-funded program. The Department of Mental Health wants to change that with a $36 million proposal.
This is so important as they have not had a rate increase in almost 20 years for some of our programs.
If it's included on Governor Lee's new budget, it would raise pay rates by 20%.
We would have improved rates, which allows us to pay our staff better. And that's fundamentally what we're hoping for as the budget advances.
In Knoxville, I'm Caitlin Keenahan.
Governor Lee is expected to present his budget for the next fiscal year before the end of January. The $36 million cost of living adjustment is just a small part of the department's proposal.